All right. Well, welcome everyone to tonight's webinar. Can everyone hear me? All right. Welcome everyone to tonight's webinar. My name is Arlene Walker, and I'll be your moderator for this evening's session. We'll be emailing you the recording of this webinar, so you won't have to take notes. Also, we've set aside a half hour after the presentation for questions and answers. You'll be typing your questions into the chat box at the bottom of the Zoom window. Sometimes you'll find that questions you have get answered as Dr. Meschino moves through the presentation. So I recommend that you make a note of your questions during the webinar and type any unanswered questions into the chat box at or near the end of the presentation. Before we begin, I'd like to tell you about our presenter, Dr. James Meschino. Dr. Meschino is the author and co-author of 4 nutrition, wellness, anti-aging books, including his most recent, Healthy Aging Naturally, which can be found on the Adeeva website. He's an associate professor in the Division of Physiology and Biochemistry at the Canadian Memorial Chiropractic College, where he's taught several courses on nutrition and biochemistry since completing a master's degree in nutrition and biology in 1984. He's also taught nutritional medicine courses for numerous organizations and corporations, both in Canada and the United States, and has appeared on many TV and radio shows, including his Detroit PBS special, Healthy Aging Naturally. Having published over 150 review papers on nutritional and lifestyle medicine in the prevention and complementary management of common degenerative health conditions, Dr. Meschino has established himself as an expert on the evidence-based application of nutrition and lifestyle practices in disease prevention and management, as well as anti-aging. He is also the formulator of Adëeva Nutritionals supplement products sold in Canada and the United States. On behalf of Adëeva Nutritionals, the sponsor of this webinar, I want to thank everyone for attending this evening as Dr. Meschino presents this very timely research-based webinar on anti-aging supplements that really work. I'll now hand this over to Dr. Meschino.
Thank you, Arlene. I appreciate it very much. That was a great introduction. Welcome, everyone, and thank you for putting some time aside to listen and watch this presentation. If you haven't seen it before, I think it'll be quite eye-opening. So our topic for tonight is looking at how the body's aging clock works and where some key dietary supplements can play a role in helping to slow down and even reverse certain aspects of aging, helping to reduce risk of certain degenerative diseases, which I will explain as we go along. So I think it's fair to say that if you walk into a health food store, you see this sea of all these different supplement products there. It's very confusing, and it's really a bit of overkill as well. I mean, not everything that you see there is really that effective. So you have to, if you're going to take supplements, I think it's important that you understand how to take things that are personalized to your own specific needs. And I'm going to try to help you understand that today. So, of course, wellness and proactive lifestyle strategies to slow aging and prevent disease requires more than just taking a bunch of supplements. You need to have a smart, healthy diet along the way. You should be exercising, avoiding things that can cause cancer, getting adequate sleep, trying to manage stress, have a good attitude. All those other things are extremely important. Where supplements play a unique role is that they can do things, the right supplements can do things that diet, exercise, and even drugs cannot do. So certain supplements that I'm going to share with you tonight are really emerging. It's key interventions to combat age-related changes in the body's aging clock, which help maintain a more highly functional body and mind as we age. That's something that I think everybody wants. How do you maintain a highly functioning body and mind for as long as possible? We call that healthy life expectancy. It's one thing to have longevity, but spending the last 10 or 15 years in a wheelchair with an oxygen tank, and you have dementia and arthritic changes, you can't walk around. You're alive, but it's not really functional living. So the reason I teach this webinar is because supplements can do some things that diet and other lifestyle factors and drugs cannot do to help pave the way to make that happen. So what I'm saying is that up to about age 40, in terms of how the body's aging clock is working, it really allows you to get away with a lot of sins. But after age 40, there's certain sort of timed events in the body's aging clock that start to go off in sort of a staged manner. The time bombs don't all go off at once, but slowly over time, predictable things happen, the same way that women know that as they approach menopause, menopausal symptoms are going to show up. So you basically know roughly in life when that's going to happen, but there's other things happening behind the scenes that are more hidden, but act kind of like the menopause trigger. There's certain events that go off at certain timed events that lead to sort of degenerative changes over time that produce a lot of outcomes that are very undesirable. What I'm saying is that certain supplements can help to combat those changes in the body's aging clock to make sure the body can maintain a more functional life. So I'll show you what I'm talking about. I'm saying that if those biological events that are in the body's aging clock are just left unchecked, it leads to degenerative changes in our joints that sets the stage for osteoarthritis. It leads to changes in the heart muscle that increases the risk of congestive heart failure. People have less energy as they get older. Their blood pressure starts to rise. What else happens? Their immune system becomes weaker, makes them more prone to virulent infections that can end their life from viral infections and other infections. And it makes you more prone to cancer if your immune system's not working at a more optimal level. And also the liver can't detoxify things as well. That's why when doctors prescribe drugs for older people, they adjust the dosage down because they know their liver can't detoxify it at the same speed. But by the same token, certain cancer-causing agents that get into our body are not being detoxified at the same rate. So they're left to circulate more freely and cause damage that can lead to cancer. So what you want to try to do is not let these events occur in a way that can lead to these negative outcomes. And supplements play a role in this. Also, men know that if they live long enough, 90% of men are going to have an enlarged prostate gland. It doesn't need to be that way. Diet and lifestyle factors and certain supplements can block many of the steps that lead to these outcomes. Women can get through menopause in about 80% of cases by using some natural interventions that can ease menopausal symptoms. Also, things that can support bone health so you don't have bone loss and osteoporosis. Don't let your muscles undergo breakdown so you don't become frail and weak as you get older. Nutrition, lifestyle, and targeted supplements can help prevent and sometimes reverse the biological steps involved in developing these conditions and outcomes. But today's focus is just going to be on supplements. So that's going to be the feature because that's what I promised in this outline. So let's start at age 40. At age 40, the first genetic time bomb of aging goes off. And that's when behind the scenes, you don't realize it, but joint cartilage is starting to become eroded, which quietly starts to set the stage for osteoarthritis or degenerative arthritis. And what that looks like schematically, here's a healthy joint on the left-hand side, and you have where the knee joint is, you have all this nice cushion pink cartilage here that's a shock absorbing pad. But as you get older, very often the cartilage sort of disappears and you start to get arthritic changes. So what we had started to understand in terms of what happened to that cartilage, why do you go from a healthy knee to a more degenerative knee, is the fact that one of the major events that occurs around age 40 is that the body stops making optimal amounts of this particular nutrient called glucosamine, which you cannot get from food. You can only get it from supplements. So here's sort of how it works. Normally, when you're younger, the normal blood sugar that you have called glucose, it produces energy, as most people know. But some of that glucose gets siphoned off to form glucosamine. And then from glucosamine, you start to form part of these components that become the cartilage, like chondroitin. So after age 40, this process of converting sort of blood sugar into glucosamine is tremendously inhibited. In fact, we know the exact step where it's blocked. So here's blood sugar becoming glucosamine, and it's this particular biological step, this particular enzyme. It's known as the fructose 6-amide transferase enzyme. You don't have to remember that. What you have to remember is that after age 40, that conversion, that enzyme becomes much more sluggish and doesn't work as well. So you end up making less glucosamine, and then glucosamine gets converted into galactosamine, and that becomes an important part of chondroitin. So if you can't make enough glucosamine, then you can't make the chondroitin that's necessary. And chondroitin inside your cartilage is like the mortar between the bricks. If you're building a house, you have bricks, and the bricks in the cartilage are collagen and elastin fibers. But the mortar between the bricks that holds it together is actually chondroitin. And the chondroitin also acts like a sponge, absorbing water into the cartilage to make it very, very shock absorbing. So you can see it represented here. This is the proteoglycans. This is really chondroitin they're talking about here. It's drawing water into the joint cartilage to give it the shock absorbing properties. So after the age of 40, as you stop making optimal glucosamine, you make less chondroitin sulfate. And so you're losing the shock absorbing property of the cartilage, but the rate at which you break your cartilage down is now faster than the rate that you can synthesize it. So you start to get joint cartilage erosion. And then one day, if you're really unlucky, and like most people, you go from having a healthy knee joint on x-ray, where this black space here is where the cartilage would normally be on a normal x-ray. And you see how it's disappeared. This person has major joint space loss, arthritic changes at the knee. The knee's now going to become stiff and painful and swollen, may need knee replacement surgery. What I'm saying is that the only thing that's ever been shown to halt this process is the use of glucosamine. So to understand the story in a bigger way, you also want to try to reduce the inflammatory components that also increase with aging as well. So you want to have, as much as you can, an anti-inflammatory diet, where you're eating less animal fat from beef and pork and high-fat dairy products, and having more fish with omega-3 fats and plant-based foods are really helpful because they help to prevent the buildup of a lot of inflammatory chemicals that can produce inflammation and pain, and also speed up the degeneration of the joint cartilage. The other thing that you do is you take glucosamine after the age of 40, at just a very low dose. You don't need very much. To prevent osteoarthritis, you don't need a lot. But you should take that glucosamine with other natural anti-inflammatories. What I like are quercetin, bromelain, and MSM. What a lot of companies do is they make a supplement that contains chondroitin sulfate. So you say, that makes a lot of sense. If my joint cartilage isn't making the chondroitin, why don't I just swallow some chondroitin? The reason that it's a waste of time is that chondroitin is a gigantic molecule that your body can't really absorb. It's much better to give your body the building blocks of chondroitin, which is glucosamine, as you're going to see from the research, and then to wrap the glucosamine around some natural anti-inflammatory herbs and take that as a supplement. So just to give you some research support, this fabulous review article written in the Therapeutic Advancements of Musculoskeletal Disease really reviewed all the research using glucosamine for osteoarthritis, saying that when you administer it orally, it is a treatment for osteoarthritis. It not only helps to have cartilage building effects on the joint cartilage, but it reduces a lot of these inflammatory chemicals that normally get produced as you get older that also destroy the cartilage. As a whole, the use of glucosamine in the management of osteoarthritis is supported by clinical trials performed with the original prescription, which is glucosamine sulfate. A lot of companies now sell glucosamine hydrochloride and glucosamine, different versions of glucosamine. But the studies show that it has to be glucosamine sulfate. That's where the evidence is best. So in particular, long-term pivotal studies of crystalline glucosamine sulfate, here's the dosage, 1,500 milligrams a day. That's the therapeutic dosage. For prevention, you don't need that much. But 1,500 milligrams once a day has shown significant and clinically relevant improvement in pain and function in people with knee osteoarthritis. Continuous studies of 3 years show that it reduces the progression of joint cartilage damage versus the placebo. And it also helps to slow down the osteoarthritic changes that we see on X-ray as well. Now, there are no drugs that can do that. Diet and lifestyle alone can't do it. There's even exercise can't make these kinds of changes on an age-related series of events related to cartilage degeneration. So the studies are very clear that the only molecule that can actually stabilize joint cartilage as you get older is glucosamine. They go on to say it's extremely safe. This is the dose, 1,500 milligrams a day if you already have a problem. And compared to other types of glucosamine formulations, this is the superior form, glucosamine sulfate. We see that raises blood levels, the joint levels, the synovial fluid levels in the joint of glucosamine increase after oral administration. So I love glucosamine sulfate. But because as you get older, there's also an inflammatory component that occurs. It's part of aging. I like combining glucosamine with some natural anti-inflammatory agents. The first one I like is MSM, methanol sulfonyl methane. It's a natural occurring substance. In a lot of experimental studies, it's been shown to inhibit the inflammatory process. But in anecdotal evidence that we have from human studies, we also see in open trials that MSM reduces inflammation as well. Reducing all these inflammatory chemicals, understanding what dosage is effective. It's really, because it has multimodal effects on decreasing inflammation, I really love MSM. And I also love quercetin, which is a flavonoid, which also has been shown to modulate inflammation and decrease the inflammatory process by blocking certain inflammatory steps that normally would lead to age-related, more inflammatory outcomes. You know, if you've ever put your hands on people's knee joints as an example, typically as people get older, even if the knee joint is functional, what often you see is that there's sort of a little bit of puffiness around the knee, just as part of aging. When you take MSM and glucosamine and quercetin, very often that sort of effusion, that little bit of swelling goes down and the knee joint looks much more youthful because there's less swelling there. All kinds of studies have been done showing the benefits of quercetin, this flavonoid, on reducing inflammatory markers. It may even be helpful in gout. And then in the stem of the pineapple plant, you have bromelain enzymes, which have been shown to be absorbed intact, have also great inflammatory effects, and has been used in human studies to relieve osteoarthritis. So that led me a number of years ago, as the research emerged, to create a product that I wanted for myself after the age of 40, which is Adëeva Glucosamine Joint Formula. It shows you that it contains glucosamine sulfate with MSM, with quercetin, with bromelain enzymes, all in one capsule. Now, when you're just wanting to prevent degenerative changes in your cartilage after the age of 40, you really only need to take one capsule a day. So this bottle would last 3 months. I took from the time I was 40 till now I'm 67, I've taken 1 or 2 capsules a day for that period of time. And my joints, I will tell you, even on X-ray, are in really, really good shape. If a person already has osteoarthritis, they need the more therapeutic dose, which is 3 capsules a day. If they're over 200 pounds, they need 4 capsules a day. If they're on a diuretic drug, they need 4 capsules a day because they're going to wash it out at a faster rate. But that product after age 40, if you're over the age of 40, it makes sense, in my opinion, to take a product like this to prevent joint cartilage erosion that's going to occur. It's part of the body's aging clock. There's just no other way to do it, to be honest. Then at age 45, the next genetic time bomb goes off in the body's aging clock. The energy shortage begins, where people start having less energy. It's not just that they feel they have less energy, the heart muscle ends up with less energy as well. And that's because that's around the time when your body makes significantly less coenzyme Q10 or CoQ10. The same way you make less glucosamine at 40, by 45, you're making less CoQ10. And CoQ10 is needed in the energy factories of all your cells to convert the food you eat into energy. So if you can't make as much energy, then for instance, the heart pump starts to get a little weaker and can't pump with as much force. And it's one of the reasons why, after the age of 65, the leading cause of hospital admissions is from congestive heart failure. Now, that can come from a number of different problems. You could have clogged arteries and other things can happen. But the decline in coenzyme Q10 is definitely a factor. We see that in 75% of people with congestive heart failure, their heart muscle levels of CoQ10 are tremendously depleted. And when you give the CoQ10 back, in many cases, the heart muscle starts getting stronger again. And CoQ10 is also important to help reduce the natural rise in blood pressure that occurs as people age. It also modulates the immune system and it shows some anti-tumor effects, but that's sort of beyond what I wanted to talk about today. Here's the energy factory of the cell. It's called the mitochondria. And normally, here's the CoQ10 is in the mitochondria, the energy factory. And it's just shuttling down parts of the foods that we eat called hydrogen to make the energy that all the cells use, which is ATP energy. So if you have less CoQ10 available, it's like you're missing pistons in the engine of the car. It can't fire on all cylinders. So the car power starts to become significantly compromised. 98% of all the energy that you're used in your body at this very second, as you're just sitting there watching me, including in your brain, is using this pathway of energy production, converting food into ATP energy, and CoQ10 is required. If you have less CoQ10, everything starts to shut down and the energy is less in your heart, in your brain, in your lungs, and other tissues. So the heart starts to struggle. It goes from a normal heart to a heart that's enlarging because it's struggling to beat and it's having a hard time generating energy. And then as the heart muscle struggles in congestive heart failure, fluids start to back up in the system and start to sort of effuse into the lung field. And the person now has fluid building up in their lungs. They're really drowning in their own fluids. And this becomes the leading cause of hospital admissions in people over the age of 65. One of the ways to prevent congestive heart failure in your lifetime is to be taking coenzyme Q10 at a very low dose after the age of 45. The other thing about CoQ10 that's interesting is that when people have cholesterol that's high, doctors often put them on cholesterol-lowering drugs like Lipitor and Crestor. These are known as statin drugs. And what the statin drugs do is they block the synthesis of cholesterol. You see cholesterol down here? Here's how the body makes cholesterol from this common building block, which the body has lots of acetyl coenzyme A. And then it just basically changes it till it becomes cholesterol. So the drugs work by blocking this particular step. Statin drugs block the step right here, and they lower cholesterol. There's no question about that. But while they're lowering cholesterol, they're also blocking the pathway that leads to the production of coenzyme Q10. Coenzyme Q10 is also called ubiquinone, which you see down here in the corner. So as you block this cholesterol, you're also blocking CoQ10. So you're hastening the decrease in CoQ10. So what we've seen is that since the introduction of statin drugs, the incidence of congestive heart failure has actually increased by 20% across the population. And we have actual case studies showing that here's the ejection fraction of the heart, how hard the heart is pumping. And here's the person's coenzyme Q10 level. Then you put them on a statin drug and the CoQ10 levels drop because it's being blocked. The synthesis is blocked and the heart becomes very weak. The heart pump starts to get weak, leading to congestive heart failure. You take them off the statin drug and everything comes back. It's not that people need to go off their statin drugs. It's that if you're going to take a statin drug, it even says right in the fine print of the literature, you should be taking coenzyme Q10 with this drug to make sure that you don't run out of CoQ10 and end up with congestive heart failure. But sometimes that messaging doesn't get across to the patient. Fantastic study in 2018, this 12-year study where they just took elderly people in Sweden where cardiovascular disease is a primary problem, just like it is in North America. And they said, because of all the amazing studies on coenzyme Q10, let's give this large group of elderly people coenzyme Q10 and some selenium versus the group that just gets the placebo. They did it for 4 years. And then 12 years later, they're saying, after 12 years of follow-up, the group that got the coenzyme Q10 and selenium did extremely well. What happened is the present follow-up revealed a reduction in cardiovascular death, mortality risk, dying from cardiovascular disease of more than 40%. and a significant risk reduction in those that already had high blood pressure, heart disease, impaired cardiac function, and diabetes. So even in people with high risk for cardiovascular disease, giving them these supplements of CoQ10 and selenium, I'll show you how to get the selenium in the end, but the CoQ10 becomes a really important feature of maintaining cardiovascular health as you age. I just can't emphasize how convincing the studies are. And it's not just with CoQ10, it's also with the herb hawthorn, because hawthorn works with coenzyme Q10 to be able to help the cells generate more energy, including the heart muscle. It also helps to open up the coronary blood vessels so more blood can flow to the heart and has a natural blood pressure lowering effect. What I will say about hawthorn in terms of precautions is that if you're on the drug digitalis or digoxin, you can't take hawthorn at the same time. That's a drug nutrient interaction that's very important to know about. But here's a 2013 review of hawthorn. Just this slide is outlining all the cardiovascular benefits, showing the range of cardiovascular pharmacological properties. It's an antioxidant. The positive inotropic, that means that it helps the heart muscle pump with outstanding force, anti-inflammatory, cardiac remodeling, decreasing platelets from clumping together and forming abnormal clots, opening up blood vessels so that you don't end up with clots and the blood and more blood flow to the heart muscle, helping to decrease arrhythmias from occurring, which is another common problem as people get older, lowering cholesterol and triglycerides. I mean, hawthorn is just this incredible herb, but you have to take it at the right dose and standardized grade. They went on to say this about congestive heart failure. Reviews of placebo-controlled trials have reported both subjective and objective improvement in patients with mild forms of congestive heart failure on the New York Health Association scale 1 to 3. Also helpful in high blood pressure and people that have hyperlipidemia, it's high cholesterol and high triglycerides. So it's just an outstanding cardiovascular supplement to support cardiovascular health. It doesn't replace taking medications. It is simply a complement to maintaining good cardiovascular health after the age of 45. If you're under the age of 45 and not taking a statin drug, then it's not, this is not a requirement. But after age 45, things really head south in a hurry. And also quercetin, which we talked about earlier around the joint formula, but quercetin has blood pressure lowering effects that I think are important as you get older. So I put together for myself when I was 45 years old, Adëeva Cardio Essentials, right? That has the CoQ10 and the standardized grade of hawthorn has been shown to be effective with additional quercetin. This is like a Cadillac product for cardiovascular support. At age 45, you need 1 capsule a day. The bottle will last 90 days. By age 60, because your CoQ10 synthesis has dropped even further, taking 2 to 3 capsules makes sense. If you're already on a statin drug like Lipitor or Crestor, you probably would benefit tremendously by taking 3 capsules a day. Then when you get into more complicated cardiovascular issues like dilated cardiomyopathy, which is very serious, I have seen patients help significantly giving them higher doses, but this requires physician monitoring. This is not something you can just self-administer. I just want you to know that we have reports on file of it having effects even in situations like this. But because this supplement contains hawthorn, you can't take it if you're on the drug digitalis or digoxin. So at age 40, the cartilage starts to erode. You can stop that or help to slow it down or prevent it. At age 45, there's a power shortage. Cardio Essentials can help to take care of that. Then at age 50, your immune system gets weaker and the liver detoxification function starts to become significantly more sluggish. And so when that happens, when the immune system is not working optimally and your detoxification processes are not nearly as effective, that's when that's the reason why older people, when they have an infection, it often becomes much more serious than someone who's younger. That's typically the case, especially right now as we look around the world. It's also one of the reasons why cancer incidence is much higher as people get older. The immune surveillance is not as good. And also cancer-causing substances can circulate through the body without being detoxified as effectively. So we run into trouble. So why does the immune system become weaker after the age of 50? Well, the aging process alone plays a big factor. So after at age 50, and certainly by the time you're 55 or 60, the thymus gland, which is sort of behind the breastbone, sort of shrivels up. So a lot of the immune cells that come out of the bone marrow, they go to the thymus gland, and the thymus gland would secrete hormones that would get the certain types of immune cells like the T lymphocytes to really be super intelligent so they can fight an infection, spot cancer cells and kill them. But the thymus gland sort of shrivels up as we get older. So the immune system doesn't work as well. These lymphocytes are not as intelligent. Plus, over time, there's an accumulation of free radicals that weakens the immune system, so the cells don't work as well. And certain immune cells can't generate these explosive bursts that would normally kill viruses and bacteria and cancer cells. Now, taking more vitamin C in, like 1,000 milligrams a day of vitamin C, can help to maintain those respiratory bursts. So we'll talk about vitamin C a little bit later. But typically the immune system's weakening after the age of 50. And then other things happen. Certain medications can weaken the immune system further. Compromised immune states like diabetes, HIV infection, overtraining at your workouts, this can weaken your immune system. Depression, stress, lack of sleep, alcohol, other drugs, smoking, THC and CBD products, from marijuana can also weaken immunity. Overtraining in the gym, stress, as I said earlier, all these things weaken immune system function. So by age 50, most people have some combination of this going on, and their immune system's weaker. And these are the references to support the things I'm talking about here. And so how it translates into what we see in day-to-day life is look at the incidence of colon cancer in Canada after the age of 50, how it goes. It just shoots up like a rocket. And I'll show you breast cancer next. Here's breast cancer after the age of 50. It's not that you don't produce cancer cells when you're younger, you do. It's just that after the age of 50, when the immune system the surveillance is not as good, the immune cells are not as intelligent, cancer can get traction. Same with prostate cancer after the age of 50. These are Canadian statistics, same thing in the United Kingdom. This slide just really spells it out so beautifully. So it's not just that, taking supplements is important to prevent these things. There's diet and lifestyle factors as well, but certain supplements can help to support immune system function and enhance detoxification. And that should not be overlooked. So if you look at how the liver detoxifies things over time, you see that this big blue-green thing here is the liver. And when certain things circulate into the liver, different toxins and other things that have to be detoxified, notice that there's step 1 and step 2 detoxification. And step 1 requires, all these B vitamins and antioxidants like vitamin C and vitamin E and carotenes like beta carotene. But it also requires milk thistle. Do you see that here? And phase 2 detoxification requires a lot of different amino acids that we get from protein and food, but also garlic and onions play a role if you're eating those. And from cruciferous vegetables, broccoli, Brussels sprouts, cabbage, cauliflower, bok choy, turnips, kohlrabies. I think Tonda's on the call. I think she'll be happy if I say kohlrabies, which they grow in Alberta. These particular vegetables, this cruciferous vegetable family, contain a particular molecule called the indole-3 carbinol, which is really spectacular at detoxification, has some other anti-cancer properties. So to support the immune system and detoxification as you get older, you need the antioxidants and selenium and zinc and beta carotene, also vitamin D and A, and after the age of 40, even melatonin is a consideration. But then some special nutrients like reishi mushroom extract and astragalus can really support immune system function in unique ways. And milk thistle, as we saw on the last slide, and indole-3 carbinol really help to enhance detoxification, to keep those detoxification processes optimal every day of your life. People say, oh, I'm going to do a liver detox for a week. I'm like, no. You want your liver to be doing optimal detoxification every single minute of your life. Don't wait to do this twice a year. You need to put these nutrients in every single day. So with respect to reishi mushroom extract in the immune system, right here on WebMD, in a fantastic review article, they say that reishi mushrooms are among several medicinal mushrooms that have been used for hundreds of years, mainly in Asia, to treat infections. More recently, also shown treatment for pulmonary diseases and cancer. Medicinal mushrooms have been approved as adjuncts to the standard cancer treatment in Japan and China for more than 30 years and have extensive clinical history of safe use as single agents or combined with chemotherapy. Reishi mushrooms are incredible. I'm going to show you how they work in a moment. In fact, here's the slide. So when you swallow reishi mushroom extract, what's unique about them is they contain these beta-glucan molecules and on your immune cells, right in your stomach, right in your gut, there are little receptors for the beta-glucans to enter right into the immune cells called macrophages. Then the macrophages sort of chomps them up and spits out little fragments, which then stimulate all the other immune cells in the body, which increases their efficiency and brings them back to more youthful function. So what I've been saying up till now is after age 50, your immune system gets weaker. How can you strengthen? How can you bring it back to more youthful function? One of the things that's been shown to be highly effective is reishi mushroom extract. And here's another slide showing the same thing, the beta-glucans on the receptor. It activates the immune cells, and they're better at killing viruses and bacteria, identifying cancer cells, and secreting all kinds of certain chemicals that make the immune system work more efficiently. I personally wouldn't be willing to take the risk of going the rest of my life without having reishi mushroom extract. So if you want to read more about that, these are some great review papers on medicinal mushrooms, which include reishi mushroom extract and some of the other medicinal mushrooms like shiitake, turkey tail, cordyceps. Fantastic review articles here. And then the herb astragalus, just in the year 2020 in the journal Frontiers of Pharmacology. So here's a pharmacology journal saying, supplements can do things that drugs can't do. And astragalus is one of them. Look at all the effects it has on immune system modulation, strengthening the immune system, causing cancer cells in certain cases to commit suicide, all this great experimental evidence that we have. But even in clinical studies with humans, you're seeing astragalus showing antiviral effects, all kinds of amazing things that just eating food, exercising, sleeping, being a vegan, it's not good enough to keep your immune system optimal according to the evidence that we have. So it's a nice illustration. Here's under the electron microscope, a cancer cell. And these little puffballs here in the vicinity are actually immune cells called the killer T cells, which normally can find a cancer cell, secrete chemicals, and blow the cancer cell up there. 15 minutes later, it's totally destroyed. And here's another cancer cell in the middle. These are macrophages, right, which depend on reishi mushroom extract, right? They can stimulate those macrophages to find cancer cells and knock them out. But as you get older, after the age of 50, these immune cells can't do it as well as they could when you were younger. And there may be no way to bring it back to the most ideal, youthful way that you had your immune system working when you were 19 years old. That may not be possible. But we know that reishi mushroom extract with astragalus can bring that immune system back and make it much more intelligent than it normally would be, especially if you're taking a high potency multivitamin that has the vitamin C and the beta carotene and the vitamin E and the zinc and the selenium. I'll show you that later. So I created at age 50 Adëeva Immuno Detox Prime that has reishi mushroom extract at standardized grade that's effective, astragalus at the standardized grade that's effective, with milk thistle and the indole-3 carbinol to also be maintaining detoxification. I put it all together to make it easier for myself to access it all into Immuno Detox Prime. You need 1 to 2 capsules a day after the age of 50. If you're starting to get a bit of a flu or a cold, you might want to take 4 capsules twice a day. And I sometimes will take Adëeva Oregacept capsules to help support that. Now, we're in a pandemic right now. You start getting cold and flu symptoms. The first thing you do is you get tested for COVID-19 and you follow your doctor's orders. But in the meantime, for general support of the immune system, this is information after the age of 50. I think it's quite valuable. One of the things I also have done during the pandemic is I ordered this product from mushroomharvest.com. It's a 14 mushroom blend. I take 1 teaspoon a day. Tastes awful. just sort of mix it into some juice, just to give my immune system just a little bit more support. But Immunodetox Prime is really the foundational product here. Then at age 55, there's another genetic time bomb that goes off that we're all familiar with. People's memory starts to decline, and it can lead to dementia and Alzheimer's disease. So what happens after the age of 50 in the body's aging clock that allows this to occur? Well, the brain starts to run out of the memory chemical called acetylcholine. And why is that? And that's because after the age of 55, normally in foods that we eat, there's some choline. And normally when you're younger, that choline can get pumped across from the blood into the brain, and the brain will use that choline to make the memory chemical acetylcholine. But after the age of 55, the brain can't pump the choline across because the pump starts to break down and becomes weaker. So slowly over time, you start running out of the choline that you have in your brain, and you can't make acetylcholine. And there are no drugs that can increase the synthesis of acetylcholine. They don't have drugs like that. But there are supplements that can do it. And so let me show you how this works. So here is the memory chemical acetylcholine. Notice that it's made from choline. So choline in just one step becomes acetylcholine. If you can get choline into the brain after the age of 55, it'll become acetylcholine unless the brain cells are already badly damaged. If you're a person with advanced Alzheimer's disease, the nerve cells are already dead and dying. They can't make this conversion. But what you want to do is prevent that from occurring in the first place. After age 55, you don't want to be waiting for significant memory loss to occur. You want to maintain optimal acetylcholine. So you have to get choline into the brain. I'll show you how to do that. Notice that serine can become choline. And I'm going to show you that a molecule called phosphatidylserine, a supplement, can get into the brain and become more choline and also help support acetylcholine. Notice also that acetylcholine gets broken down by this enzyme. It's called acetylcholine esterase. If you could slow down the breakdown of acetylcholine, it also raises your acetylcholine levels. So there are supplements that can do all of these things. Get more choline into the brain, get more serine into the brain, and increase acetylcholine, and then slow down the breakdown of acetylcholine. It's the best of all worlds. And so there are no foods that can do that. There are no supplements, there are no drugs that can do all those things. Only supplements can actually make all those things happen synergistically. So the type of choline that can cross into the brain after the age of 55 is a unique kind of choline called Cdp choline, or cytidine diphosphocholin. And studies have shown that it gets into the brain and helps to raise acetylcholine levels, and it does some other really important things to help brain function maintain itself. And so Cdp choline is the gold standard form of choline for people over the age of 55. Once again, that choline, once you get it into the brain, becomes the memory chemical acetylcholine. But again, so does serine can also make that conversion. So Cdp choline in clinical studies have shown its efficacy for senile dementia, dementia related to cerebral vascular disease, for stroke recovery, for early Alzheimer's disease, for concussion treatment. It's shown evidence for all of these issues. Even in Parkinson's disease, it can be helpful to some degree. And so these are the reference. This is a great review paper on Cdp choline published in recent years. But I like Cdp choline combined with phosphatidylserine because serine can also become choline. In the Indian medical system, they use Bacopa monnieri to improve memory because it helps with nerve transmission through the brain. And in China, they use huperzine A because it slows down the breakdown of acetylcholine. So the combination of these four things, which I put into Adëeva memory support complex, after the age of 55, in my view, is invaluable because there are no drugs that can replace what these supplements are doing. There's no food that can do it. Being a vegan can't do it. Exercising alone can't do it. All those things are great, but they can't support choline levels in the brain the way that memory support complex can. So I think after the age of 55, it's risky business not to be taking a supplement like this. Now, to further support the efficacy of this, I do take some additional choline from a supplement called lecithin, I take 2 capsules of 1,200 milligrams of lecithin a day. And I also make sure I take Adëeva Nature's Essential Oils from Adeeva, which contains fish oil, which is also helpful with the nutrients you're seeing here to maintain brain function and memory consolidation. What is a dosage that you would take of memory support complex? After the age from 55 to 60, if you just took 1 capsule a day, that's plenty. From 60 to 70, you should start taking 2 capsules a day. After the age of 70, I think you should be taking 3, just to really maintain that memory chemical in the brain. For people that have mild cognitive impairment, I've seen them help tremendously by taking 3 to 4 capsules twice a day, but that's a therapeutic dose. Again, adding the lecithin and also the essential fatty acids found in Adeeva Nature's Essential Oils complements the efficacy of Adeeva Memory Support Complex. These things all sort of work synergistically together. So 2 final issues that we'll go through quickly. The aging of the male prostate gland, and also what happens at menopause. So in males after the age of 40, the same way that cartilage is undergoing erosion at age 40, and there's a power shortage at 45, and the immune system gets weaker at 50, and the brain acetylcholine levels drop at 55. For males at around age 40, they start converting more testosterone into a more dangerous kind of testosterone. I mean, it's a really dangerous form of testosterone. It's called DHT, or dihydrotestosterone. And as it builds up, it causes prostate cells to divide at a faster rate. And when that happens, the prostate starts to enlarge. When cells divide faster, there's a greater risk that they'll make mistakes and cancer can occur. So what you want to be able to do is to block the buildup of DHT. Certain foods can be helpful, like eating cruciferous vegetables can be very helpful. Eating soy products can be helpful in blocking that. But there are supplements that also do an excellent job that should be added after the age of 40. So what you want is for a prostate gland. Here you see the prostate gland is orange here. Here's the cross section. Here's the bladder, and the urine has to flow through the urethra here. If the prostate enlarges, it squeezes the urethra, so it's hard to urinate. So men are having a hard time urinating, that they have decreased urine stream. And it's because the prostate cells are dividing and the prostate's enlarging. You want to slow it down and reverse it as much as you can. Diet's an important factor, but supplements play a key role. Once again, after the age of 50, prostate cancer becomes like a runaway train in men, as does prostate enlargement. You want to try as best you can to block the steps that lead to these processes. And these are the steps that you want to block. You want to block the buildup of DHT. You want to prevent too much testosterone from getting into the prostate gland in the first place, because that gets converted into DHT. And when you want to block too much estrogen from getting into the gland, because estrogen supports DHT levels by slowing down its breakdown. And you'd like to, if any cancer cells are starting to emerge, you want them to commit suicide. We call that apoptosis. And if there are any tumors forming, you want to shut off their ability to make new blood vessels so they can't spread. So a combination of certain supplements have been shown to be able to do that. So here's what those steps look like. This large rectangle is the prostate gland. Here's the testosterone coming in that was made in the testes, and it gets converted from testosterone into DHT. But if you can block this enzyme, this 5-alpha reductase enzyme, you can slow down the buildup of DHT and slow down the rate at which cells divide, and prostate enlargement can reverse if it's not already too far gone. But you want to start preventing this from the minute you're 40 years old. You don't want to wait. And these are testosterone getting in. Here's androstenedione. You can block these receptors to some degree with certain supplements that I'm going to show you, so you don't have so much testosterone in there in the first place. And then if cancer cells are starting to form, cells are not stupid. They can trigger certain surveillance genes, like the P53 tumor suppressor gene, can tell the cell to commit suicide. So there's certain nutrients that can help this gene work more intelligently, like beta-cytosterol, which we put into our prostate formulation, helping cancer cells identify that they're becoming cancerous and getting them to commit suicide before they become a threat. But green tea catechins also have been shown to do this. Indole-3 carbinol from cruciferous vegetables also helps to do this. And then if tumor cells are forming, once they reach a certain size, they try to get more blood flowing into them. So they secrete this little chemical called VEGF, and VEGF then causes more blood vessels to form. You can block the secretion of VEGF so the tumors can't get more blood. So it's complicated, and it would take a long time for me to explain all of this. What I want to say to you is that if you want to read all those references and reviews that I have on these ingredients, you can find them at the Adeeva website. I have a lot of review papers on this that I've published. But the long and the short of it is that when you combine certain nutrients that have been shown to block those steps that I just showed you, like the standardized grade of saw palmetto and pygmf or cadmium, beta-cytosterol, soy isoflavone, stinging nettle, and lycopene. There's research for all of these things in blocking all those important steps. So the prostate gland has the best chance of not dividing. The cells don't divide as quickly. You block steps that can lead to prostate disease, and you help to slow the normal aging of the prostate so it stays a more youthful prostate and less likely to be a problem down the road, which, because for a lot of men, prostate issues become a hugely important factor. So diet and lifestyle are critical. Taking this supplement after the age of 40, I personally highly recommend it. So how much do you take as a dose? Well, after age 40, even just taking one capsule a day is a great idea. My father died of prostate cancer. I formulated this product for myself. I've taken 2 capsules a day since I was 40 years old. My PSA blood level is still down at 0.25, really, 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 really low, exactly where I want it. If I had a prostate that was enlarging, I'd be taking 2 capsules twice a day and also following other important steps. And you could take this supplement actually with prostate enlargement drugs. It's not a conflict. They can work synergistically, in fact. Okay, let's move on to menopause that affects women as they hit around age 50, as you know. So there's an abrupt change. It's a difficult time because there's this abrupt change in estrogen declines, progesterone declines, testosterone declines. You see, look at the drop off in estrogen and progesterone as women get older. This has profound effects on their body that can lead to hot flashes and night sweats and mood changes and irritability, and it just becomes very uncomfortable for a while. And you can lose bone, and cholesterol levels can rise, skin atrophies. There's other changes that are associated with this. Because it's dangerous to use hormone replacement therapy, giving women estrogen as they get older to compensate for that decline can lead to increased risk of breast cancer, endometrial cancer, heart disease, and stroke, clotting factors in the blood. So doctors don't like to prescribe it unless they absolutely have to. So before there were hormones like that to prescribe, what was used commonly to manage menopausal symptoms were black cohosh, soy extract, gamma arosinol. These 3 things together, there's tremendous clinical trials to show their efficacy. For about 80% of women, for about 20% of women, these herbal agents are not strong enough to actually make a significant change. But if you add natural progesterone to this combination, which is a very safe thing to do, by the way, for most women, then you can get efficacy. But 80% of women find that taking this particular concoction that we call women's hormonal balance can be extremely helpful. What the problem is that a lot of women buy these herbal products to help themselves. But if the herbal product for menopausal management contains angelica species or Don Quay, red clover, or licorice, then you're putting yourself at risk for internal bleeding and high blood pressure, skin rashes, and other problems. These are more dangerous herbs that I think you should be avoiding. These are extremely safe. Now, you can be allergic to soy, which in that case, you wouldn't be able to take this product because you're allergic to soy, but that's not a high percentage of people. But these herbs in almost any woman can lead to internal bleeding, a rise in blood pressure, skin rash upon exposure to sunlight. So I really think that if you're taking a product with these particular ingredients, that you ought to switch to something else that doesn't contain them. So as I start to wrap up to conclude, what I'm saying is that the general supplement game plan that you should consider is that throughout all of adult life, the first thing you start with at age 16 or 17 would be a high potency multiple vitamin mineral. I'll show you what that looks like. And also essential fatty acids. I think these are the 2 core foundation things you take lifelong. Then at age 40, you start introducing other things that make sense based on the genetic time bombs that would go off at age 40, then 45, then 50, then 55. So if you're like me, if you're in your late 60s, then there's a number of supplements that you really actually have to take to counter all these major genetic time bombs that have gone off. If you really want to try to optimize your chances to have a healthy, body and mind for as long as possible, not instead of diet and exercise and lifestyle, but as a complement to them, because these supplements can do things that drugs can't do, diet can't do, exercise can't do, nutrition can't do. But so this is sort of the game plan. So a high potency multiple vitamin should be one that has the extra antioxidants, like the higher doses of vitamin C and E and selenium and beta carotene for detoxification and for immune system support that I showed you earlier, the B50 complex for detoxification, extra calcium for your bones, 500 milligrams of vitamin D that you're going to need, lycopene for your prostate and cervix, lutein for your eyes to help reduce the risk of macular degeneration, the leading cause of blindness in people over the age 55. And the vitamin E form, in my opinion, should be vitamin E succinate. It is the most impressive anti-cancer form of vitamin E. So when you get this presentation sent to you, you want to click on these links. You'll be able to read the research papers on vitamin E succinate. Very few companies use this form of vitamin E, but it is emerging as a stellar form of vitamin E that has impressive anti-cancer properties. So every day of my life, I want that form of vitamin E in my body. So I created the Adëeva all-in-one multiple vitamin. It has everything that I showed you here at 1,000 milligrams of C, the 400 IUs of vitamin E succinate, the selenium at 200 micrograms. Remember that study with CoQ10 and selenium? And zinc, and for your immune system, and the B50 complex, 1,000 IUs of D, lycopene, lutein, bioflavonoids, vitamin A, beta carotene, chromium, calcium, magnesium. It's everything in one. Instead of buying 8 different bottles, just get one high potency multivitamin. It makes life a lot easier. So this is the exact breakdown of each of the nutrients. And there's the B50 complex, 1,000 milligrams of C, the 400 IUs of vitamin E. There's the calcium, a little bit of iron, not too much, so it's not toxic. Excuse me. And so on down the road. This is like a high potency multi, everything you want in one bottle. And then essential fatty acids, nature's essential oils with that combination of borage seed, flaxseed, and fish oil all in one, because you want to have those right essential fats in your body to slow down the rate of cell division, so you're less risk of cancer cells forming. You want to support the cardiovascular system with essential fats. You want your skin to be smooth, and you want to have that anti-inflammatory effect, and also supporting the brain as well as I spoke to you about earlier. So we make Adëeva Nature's essential oils, fish oil, high yield fish oil, flaxseed oil, and borage seed oil. They work synergistically to give you those incredible effects that essential oils can help to provide to the body for all the reasons that you're seeing here on the slide. But in terms of healthy aging naturally, what I'm saying is that if you're under the age of 40 and you're watching this presentation, and you say you're between age 16 and 40, you need a high potency multiple vitamin and mineral and essential oils, right? That I just showed you. Those are the only 2 supplements you really need, unless you have some health problem. But then if you're a man at age 40, you start taking a product like Prostate 40 Plus to try to slow down the changes that are going to otherwise start to occur in your prostate gland that can lead to all kinds of problems that you don't want to have. Same thing if you're a man or woman at age 40, you would take something like glucosamine joint formula to support your joint cartilage so it doesn't undergo erosion, and you suppress some of the inflammatory aspects of the aging process as well. So your joints are healthy and functional. You're not in pain. You can still be active. I mean, that's what life is about, is being able to be functional. At age 45, that's when you want to take something like Cardio Essentials with the CoQ10 and the Hawthorne and Quercetin to give your heart the opportunity to make optimal amounts of energy so the heart pump doesn't get weak. That's critically important. And then at age 50, immunodetox prime to support your immune system and your detoxification centers. Otherwise, they become sluggish. You're more prone to virulent infections and other problems that can be very serious. Around the menopausal age, women can use something like Adeeva's hormonal balance. If you're having severe symptoms and you need a little bit of support to get through that, it can be very helpful. And then at age 55, you introduce something like Adëeva Memory Support Complex, because otherwise you're going to run out of acetylcholine in all likelihood. And then your memory starts to go. By the time that happens, you're already tremendously depleted and brain cells are dying off. So you want to try to do everything possible to maintain these things, because your body's aging clock starts to work against you. And these are the major key trigger points that go off, the genetic time bombs that really catch up with people if these biological steps are left unchecked. So for many years, our ancestors, my parents, our grandparents that we had, this research wasn't available then. It's really only in the last 20 or 30 years that this research has even emerged, and we have clinical studies to show the efficacy of these particular targeted nutrients and what they can do. So to not take advantage of the science that's available, to me, seems like such a waste. So I hope that you'll take this very seriously. Along the way, you may or may not need additional bone support nutrients. Your health practitioner can help you decide that based on your bone density, how much calcium you're getting, what your blood vitamin D levels are, all that kind of stuff. But that's sort of the general scheme. So these are some final considerations, and that is, don't forget what I said at the beginning, that diet and lifestyle are the foundation to minimize risk factors for degenerative diseases. Supplements start to play a role to complement diet and lifestyle. They're not a replacement for healthy diet and lifestyle. Individuals that have kidney disease or liver disease or transplants, before you start taking supplements like this, you need to get approval from your specialist. The same as you're on anti-rejection drugs or immunosuppressant drugs. You can't just take everything that I just showed you here. You really need, it's mandatory that you get physician sign off on that. If you're on digitalis or digoxin, you don't take Hawthorne. And remember that anybody can become allergic or intolerant to any supplement or drug or any nutrient in food. So, if you find that a certain supplement bothers you, it might just be that particular supplement you can't take it, but you only really know by trying. If you're unsure about a conflict between a drug that you're taking right now and the safety of taking a particular Adëeva supplement, feel free to email me. I'll be happy to work through it with you to help you decipher whether or not you could move forward by taking something. I answer technical questions all day long. I'm happy to answer your emails. Don't hesitate to send me an email if you're uncertain about something. I don't want you to make a mistake. So I'm going to take questions in a moment. We're at the end. I want to thank you for attending this webinar. I'm very grateful. And I'm grateful to Adëeva Nutritionals for sponsoring it. And so Adeeva has asked me to tell you that they have a gift for you for attending tonight. It's a complimentary 1-year subscription to the digital Meschino wellness coaching program. So that's sort of a digital wellness coaching program that I designed with my IT people and architectural minds around here, that actually is a very highly effective leading edge wellness platform that you can use on your phone or on your computer, but it's on the internet. So once you have that digital platform, you answer these health risk assessment questions, and then immediately it generates a report that provides personalized nutrition, exercise, and supplementation considerations for you, and also highlights drug nutrient interactions that would be dangerous for you that you need to know about, that's really targeted to your own personal circumstances. So it really is a personalized coaching program. Then it gives you the tracking tools and other resources that help you stay on track and expand your health literacy and stay up to date on the latest breaking news on wellness, anti-aging, disease prevention, and the complementary management of many health conditions. So as the research is being published on a monthly basis, I do different videos and updates and healthy lifestyle boosters to keep you highly informed on the latest breaking news. That's all included in the free complimentary 1-year subscription. So I want to thank Adeeva for making this gift available to you, and look for that sign up for the Meschino Wellness platform in your inbox, probably within 24 hours of this webinar coming to a conclusion. So thank you very much for attending. I hope I didn't go over time, 5 minutes over, but I did the best I can to keep it tight. And I'm going to go to my chat box and just see what questions might be here. If you have to leave and sign off now, because not all of you are going to stay for the questions, which I'm going to answer for the next half hour. But once again, I'm really delighted that you would make this time to attend this evening. I really appreciate it. I hope this was helpful and meaningful. Please feel free to send me an email and give me your thoughts. And if you have any questions about how it applies to your own personal situation, I'll do my best to decipher. Just keep it as short and sweet as possible. Get to the point, and I'll try to give you the best answer I can if you're confused about taking something that you're not sure is right for you or someone who's a family member, as an example. Anyway, let's go to the questions. Okay. I see Tonda's on the call. Thanks, Tonda, for attending. The multiple vitamin is now in inventory again. We ran out of multis. We've had a tremendous rush on our multiple vitamin, and we ran out, but we now are fully stocked again, and we're putting plans in place to prevent that from happening in the future. So we now have our multivitamin, and we're up to speed.
One question. Cool.
Yeah, there's a question here about alpha glycerylphosphocholene as a form of choline. Alpha glycerylphosphocholene is an outstanding form of choline as well. So I said Cdp choline is, in my opinion, is the gold standard. Now, the alpha phosphoglycerylcholine is also very good, but it's extremely, extremely expensive. So when I'm formulating a product, what I want to do is try to give people the best chance of making it affordable. So because Cdp choline is the most superior form of choline to take after the age of 55 particularly, I'd rather have someone take that than take something that's even more expensive and sort of push that on them, because they end up having to spend more money. It's already additional money you have to spend to take supplements. You can't write it off on your income like you can drugs. There's no drug plans for supplements through your employer. So I've really made an attempt as I formulated products to try to, if there's two ingredients that can do the same thing, then I'd like to use the one that's going to cost the consumer a little less money. But in terms of alpha phosphocholine, it's a very, very good supplement as well. I have no issues with it if you want to take it. Any concerns about supplements interacting with blood thinning medications after a stent placement? Yes, there are some considerations for that. So if you send me an email and let me know what blood thinners you're taking, I can help. And you let me know what your age and gender happens to be and any other health conditions you have. I can help sort out what would be reasonably safe to do if you're already on blood thinning medication, as many people are. Yeah, I think what you'll find is that once you get the that 1-year subscription to the Meschino Digital Wellness Coaching Program and you fill out the health questionnaire, it's going to generate such a comprehensive report. A lot of questions that you have going forward will likely be answered. But feel free to send me specific questions that you have. So I want to make sure that you don't do something that could be damaging and you do things that are going to sort of optimize your health. And if I can guide you, I'm very happy to do it. So thank you once again for tuning in. On that note, I'm going to say goodbye and hope to see you again. We have another webinar scheduled for a month from now, and I hope to see you back then. Thanks again.